but then with a little bit of caveat, because there's a social menace that is affecting the health sector that needs to be spoken about. So it's all about Japa. Yeah, Japa. Yeah, there's a whole lot around that because, again, some of the reasons why the government are beginning to change its policies in that health sector is because of the amount of persons who have left this country. In the year 2020, when the world apparently experienced the so-called COVID-19 pandemic, there was this air of joy across the African continent. I mean, when Europe, UK, America were announcing millions of people deaths, where Africa was announcing around, say, under 50,000, was there this air of, well, hope, but it wasn't that our African health sector was that perfect or was that good or better than the Europe, but it's just that, maybe, just maybe, we had a better body, or maybe our immune system was a lot better. I think Solomon, the guest we have today, would expatiate on that, because I haven't actually gotten a clear answer regarding that, because a whole lot of persons predicted that Africa was going to be the highest hit, given the poor infrastructure we have in our health sector. But today the case is different, because again, the results of the deaths of most health workers in Europe and America is what is affecting Africa right now, because virtually everybody that works in the health sector is looking to leave. What next? We have with us live in the studio Dr. Solomon Obiadi Anigbamkpu. He's a plastic surgeon, National Orthopedic Hospital, Enugu. Good to have you. Good morning.
Good morning, my brother. Good to have you once again.
Good. First question. I mean, you are in that space. I'm sure you also have met and read several journals around the COVID-19 pandemic. Why was it like that? Was it out that African immune system was more? Did we have God by our side much more than they had over there?
I think you have actually answered the question. It borders on the immunity in the actual sense. That does not mean that other people doesn't have immunity as well. But we'll look at it from 2 points. In comparison to what you have in our locality and what you have elsewhere in the Western world. The life expectancy of people in Nigeria, for instance, is about 56 years. They're currently placed. Unlike what you have in the Western world, where you have up to 70, 80 years as a life expectancy. And you know that when you have aged population, that the way they respond to diseases is far different from what you have in young population. So the Western people were worst hit by the COVID pandemic because one, they have a lot of aged people in their place, unlike us. That's one angle I'm seeing it from. The second angle is that we in Africa, especially we in Nigeria, has been battling with a lot of diseases. And which assault of any disease, these are viral in origin. So the body tries to fight them. So because we have been battling with a lot of viruses, bird flu, common colds, things like that are much more common in the environment. Our people tend to build more immunity in this regard, unlike those of them in the Western world who were not being exposed to this level of disease in the environment. Then another thing is our own environment, the cleanliness is also another factor. People that live in a very clean, serene environment, if any disease will come out, such individuals will be more affected. For instance, if you have people who live in the city and they come back to the village, and for any patients, they go to the village stream and takes water from there. some of them will start having diarrhea. But how is it? People that who are in that village have been taking water from that stream. They have been drinking from the stream. And none of them are coming down with diarrhea. Somebody who just returned from America, maybe UK, for Christmas break, who try to do what the villages are doing, and you come down with disease.
So the person in the village must have developed an immune system against that particular...
Exactly, because they have been taking that for quite a long time.
Well, it doesn't mean that it's healthy, is it?
Yes. It doesn't mean that the water is healthy. Okay? But because of the institution they found themselves, they can't help it. You can see if you go to Niger Delta area where the crude oil spillage has polluted their water. If you see the kind of water they take, you from this side of the place will not be able to. You won't be able to take if they offer you. But they take it, but you see them, they are smiling. But you that says you can't. If you take it, you come down with all sorts of diseases.
Right. So fast forward now, 2025. It seems that this is where Africa is now suffering it. Since the health workers in abroad at the time had passed on, the only way to look now is towards Africa. And it looks like they're emptying our hospitals. How much of these Japa has impacted on our health sector so far?
Well, the Japa thing, as they say, if you look at the etymology of that word, Japa, it's actually a Nigerian language. Came from the Yoruba area. That's Japa means to run away. That's what it means, the etymology of that word. So if people are running away from their homes, from their villages, from their communities, from their town, from their city, and from their country, then something is really pursuing them. That's what it is. So the Japa syndrome didn't begin today. It's not just a 2025 issue, a 2024 issue. It has been there for a long time. It has a waves. If you look at the history of Nigeria, in 80s, there were Japa syndrome. In 90s, we had. But this in 2020s, 2021, 2022, 2023, it looks as it's now becoming so alarming that the government is beginning to put talks about what they are going to do to really stop what is still happening. I can tell you that the data available in 2021, 2022, they say we have about 85 to 90,000 doctors trained in Nigeria. Out of this number, about 55,000 are practicing in Nigeria. That means the rest have gone. By the end, yes, that's what it means, have traveled. By the end of 2024, we have more data that show that the remaining number of doctors stay practicing in Nigeria hovers between 40 to 45,000.
Wow.
And you know that WHO has made it very clear that the number of ratio of doctors to patients in a worst case scenario, you should be a 23 doctors against 10,000 patients. So if you divide it per doctors, it means that a doctor should be seen around 446 patients. But now with the number, even if I'm going to use the 55,000 as against what we have in 2020, 2021, you see that a doctor should be seen about 4,600 patients. And that is one aspect. The next aspect is that the villages or the remote areas are worse hit. People have to travel more than 30 miles from their homes to access care because of scarcity of doctors. Okay? And, it is getting worse on daily basis. And one thing I have found out is that the government is yet to understand the impact of what this Japa is having on our health institutions.
They're yet to understand.
Yeah.
You mean they don't have an idea?
I don't think so, they do.
Why do you think so?
You see, it is like a vicious cycle. People talk about doctors, Japa. You see the number of nurses that are living, pharmacists, physiotherapists, these are components of the health system. So it's not only one profession that is living.
Yeah.
That's one aspect. Then the next aspect is that it is the young workforce that are living. The young workforce. If you look at our university today, if you take a census of medical students, nursing students, pharmacy students, all the health-related courses who are already in the universities, maybe in their penultimate class, about 50 or final year, and you ask the students, do you want to practice in Nigeria? You'll be shocked. There are more than 80% of them who say no. It means that while they are in school, they are already writing foreign exams. By their final year, some of them have already passed all their foreign exams, just waiting to graduate, become inducted, and they're already living. Okay, so if the young workforce are living, the elderly ones are aging, and no one is replacing them. So a time will come when there will be a vacuum. There will be no one else, because the aged ones will be tired. They can't continue working for life because they are human beings. The young ones are not there. So who is going to work? Who is going to take care of people? Government have not seen this. We are not talking about the experiences, people who are living, and people who have got a lot of experience in the practice. They carry all the experience they have acquired. See people who have worked for 5 years, 10 years, are traveling. So do you know what it means? What it takes for you to have a replacement of somebody, maybe a consultant who has worked for 5 or 10 years before you can get somebody that will replace that person. The number of years it will take the person to acquire the same level of experience that person has. And now the younger workforce are leaving. Who are those who still have the energy to do that? If you look at teaching hospitals, now they are making adverts for employment, but people are not coming. There are departments that doesn't have young residents, because it is in the teaching hospitals that you train professionals, people that become consultants, specialists in different fields of medicine. Now you can see there are some departments that doesn't have junior doctors again.
Really?
I'm telling you. So many in this Nigeria. In fact, in everywhere, most of our institutions don't have junior doctors again. Because once you put that advert, if you advertising, you're expecting to have 1,000 doctors to apply. Maybe you now see 20 persons apply. By the time you conduct an interview with government bureaucracy, the process, when the whole process will go before they now bring out the list and bring out the employment letters, you find out that 20 that came for that interview, there is only 5 that still remaining.
They're still remaining.
It's still remaining.
For available.
Already, yes, available to take up the
job.
Yes.
Wow.
While you are printed employment letter for 20 people who came for your interview, the people that finally show up to collect is about 5.
Wow.
And that 5 that came up to collect this appointment letter will work for like maybe 1 year or 2 years. 3 will go, remaining 2. You see?
Is it the remuneration now, or the fact that they are seeking for greener pastures outside? Is that what it is?
The factors are complex. Remuneration is the topmost in them. I will give you an example. My salary as a house officer, that is during our internship as a doctor, if you convert it to dollar, it is around $1,200. This is something I did around 2015. That's about 10 years ago. That was my salary then as an intern or a houseman. Fast forward today, I am a senior registrar in the plastic surgery department, National Trade Hospital. My salary today, as it is less than $500.
Oh, the devaluation of the currency, that's the reason.
So you can imagine.
Oh.
If as at 2015, I am a house officer, which is the least on the cadre of doctors, I was earning up to $1,200 as a salary. But today, as a young specialist in the area of plastic surgery, my salary is less than $500. So what do you make of that?
Well, you look like you're going backward, or you're supposed to be progressing.
That is the issue now. So the things you can buy then, you can buy it today.
Wow.
So this is one of the aspects government has not really paid attention to remuneration of the health workers, not only doctors, it is all health workers involved. All, not one person. Okay? So if you look at that, you compare with your colleagues who are your classmates. Maybe you graduated the same time and I never wanted to leave them. So those that wanted to leave left. And today we compare ourselves. In terms of economic stability, they are far more ahead of me. That does not mean that they have more skills than myself. You see,
those who are outside
of Nigeria, yes, practicing outside. They have some of them have got their houses, building personal houses, get lands, things like that. But yes, we don't have houses. Government never provided accommodation for us in that sense. So as a resident doctor, it means from that name that we're supposed to be resident in the hospital. That means you're supposed to live inside the hospital.
Yeah.
Why undergoing that training? But the accommodation is not there. We are not living in the hospital. We live outside the hospital at the whims and caprices of the landlords and landlords. You see the way they increase house rent, almost on daily basis. Not regarding that your salaries are not being increased. As the wave of inflation is telling on everybody, the civil servants, including the health workers, are still being receiving the same salary that are receiving long ago. Okay? So the remuneration is a major factor. Because you as a doctor, if you are unable to take care of yourself, take your children to a good school, get food for your family, then what else are you doing as a doctor? That's one aspect. Two is the environment where we work. People have skills for different special interventions, but the facilities are not there for you to practice. There are many tertiary institutions in the southeast, at least the ones I know, that are supposed to have magnetic resonance image, which is one of the high-tech radiology equipment we use to investigate patients. But this institution, they don't have it. A government institution for that matter. These are tertiary institutions owned by government, some federal government, some state government. But these instruments, they are not there. So how do you work? You see a patient that has a brain injury. You needed to have MRI of that brain. You don't have the equipment in the hospital, so you have to send it outside. It's a private facility that has it for the patient to go there and be scanned and then come back to you. Do you understand? That is just one aspect. There are so many aspects. So the things that the doctors need to work are not available for them to do their work effectively as is obtainable over there. So many people, based on that, wouldn't want to stay back. You say that because you are losing the skills. Those who are some people have actually gone out for training outside the country. How to use this instrument, laparoscopy, things like that. But when you come back, probably in your center, maybe you have one, that one broke down, there's no other one to be replaced with it. So virtually all the training you have, you are here stuck. You can't practice it because you don't have the equipment to do so. So some of them will leave based on this, to go to areas where they have all these modern, technology, so that you key in, so that you don't become a, an archaic person in a 21st century. Meanwhile, you are not there yet. Okay, that's one aspect. So the facilities, dilapidated facilities you see in our health institutions are also bothering the doctors and health workers that work there. Because the environment makes you either healthy or non-healthy. Yeah, for instance, if you come into a room that is well lit, that is air conditioned, the walls are good painted with flowers decorated, I mean, you feel very happy. The environment is appealing to you as a doctor, as a health worker. It's also appealing to the patient. Okay? That makes the work easy. Patients will be happy. Whereby you come around, the places are messed up. Some of the roofs are leaking. The walls, the paint has already washed off. For years it hasn't been painted. The beds are not in good shape. If patients lie on the bed is making noise, shaking, things like that. No, come on. Yeah, we can do better. It doesn't mean that this requires, some high-tech things for you to provide. It's a simple thing to provide this thing. It's just that the government, I think the government does not patronize the health institutions in the country. Because if they do, they will be able to know that these things are really faulty. They will begin to ask questions. Why is it like that? But since they don't come around, they won't know that this thing is happening. Okay? That is another aspect. Then there is another aspect, is security. If you hear the spate of kidnapping in Enugu State for the 2024 that just ended, we have more than 7 medical doctors. We have more than 7 medical doctors who fall victims of kidnapping.
7?
Yes.
Kidnapped in Enugu?
Yes.
2024 alone?
Yes, in the year 2024. We have more than 7 incidents of medical doctors being kidnapped. In fact, there is a doctor that was kidnapped in the north, a resident, who was in captivity for more than 9 months.
Oh my God.
A resident doctor, a female for that matter. In fact, he took the actions of the National Association of Resident Doctors, who were demanding for industrial actions nationwide. In fact, we started demonstrations, carrying placards in all the tertiary institutions in whole Nigeria, demanding for the release of the young lady. And she was finally released after spending so many months, over 9 months in captivity. Then nobody's talking about the trauma the woman has faced in detention. Nobody's talking about her family, the husband and the children, her work, because she's still in training as a specialist. So these are the things people look around. So there's security challenges. So for you to go to work in some places, that's why if you employ somebody in some places, they will say, I won't come. Not because he doesn't want to come and help. Maybe he's afraid what is going to happen to him. You see? So even in the hospital itself, you have several incidences of attack from patient relatives to doctors. Doctors that are taking care of your own sick person. You are attacking the doctors for one reason or the other. You see, I look at patients, I pity them. Because during our clinics, you see that you may have about 150 or 100 people who came to see the doctors. And they are going to spend hours. Some of them will come as early as 7 a.m., 6 a.m. They will going back as late as 4 in the evening, 5, 6 in the night. And I told them, look, this thing is just the beginning. Because as they go by, it's going to get worse. Because a number of doctors are leaving, and we are not seeing people to replace with it. Then the few that agreed to stay back is already overworked. They are already overworked, overburdened, and that burden is increasing on the
Every day.
basis.
I'm just thinking to myself, you know, you've painted a whole lot. Like you mentioned, it was complicated. At the time you said it, I didn't even know to the extent that you meant it was complicated. But right now, it's becoming clearer what the situation is. Is there a solution? Because it does not look like the government is even looking to invest more in health. Because again, it would have shown, at least even in the budget, with the so-called announcements that the U.S. government is stopping aids to Nigeria through USAID. I mean, you can imagine the extent of the issues that Nigeria will face and its health impacts that it would actually make for our people. I'm just thinking, like, is there any solution that someone can provide? Because it just doesn't make any sense. If I was even in that field, the only thing that would probably be keeping me is that I just want to be back in Nigeria. Not that I want to stay because of any benefits that's accrued to me. I mean, it just don't make any sense given that. But what going forward do you think can be done? What steps must be taken urgently? I mean, I cannot say stop people from traveling because you can't hold down people. You can't tell them to not to travel because they would always. But for the people who are even available, who are willing to stay, what urgently can be done to keep them? What can we do to improve the health sector? What exactly? Because look, again, I look at the whole thing. It comes back to the politician. Like you rightly said, some of them don't even do their medicals here in Nigeria, so they don't even know the extent of damage that the healthcare has had over the years, and so you start thinking through, because if they do, they will start thinking of allocating more budgetary allocations to health. So everything is just intertwined. So urgently, as someone who plays in that sector, what must be done immediately to save the health system in Nigeria?
I think the solution is very simple, but the political will is what will determine whether government will succeed or not. We have a short-term measures and a long-term measures. You see, many people who are traveling out are not happy to live in the country. Yes.
They're not happy to live in the country?
No, they are not. Many of them are not happy living in the country because some of them will live inside their family. Okay, your children, your husband, your parents are here, and you are living, and you are far away. So many of them are not happy, but they have to leave in order to make a means for themselves and for their families. So, given the opportunity, many will come back.
Okay.
I'm very factual about this. But what is it that government is going to do to help change the situation? In short-term measures, one of the state governors and the government thinking about extending the retirement age.
Yeah, I think they mentioned that at some point. Even at the federal level, they pushed it from 60 to 65.
Yes, it has been signed into law. And for medical consultant, they getting into 70 years.
Yes.
Those ones are good, but they are just symptomatic treatment.
Symptoms, symptomatic treatment.
That's what it is. You haven't treated the disease. That is good, welcome, fine. But the treatment of the disease is for you to what? Look at the root cause of the problem. The root cause, as I mentioned, is their remuneration. Go in and review their salaries.
Okay.
And make their salaries a living wage.
At least.
Befitting of somebody in that kind of cadre of profession. Medical profession is not just an ordinary profession. When you put it in comparison with other professionals, the gamut of professionals you have in the world, the medical profession stands different because of the role we play in our life. That is one. if government will be able to make their wages a living wages, a salary that can take them home, provide incentives, give them house accommodation. It's not asking for too much for a doctor to have a place to live.
They don't provide accommodation for them?
No.
Wow.
We don't have that. I've told you, as we who are resident doctors, I'm living in a rented place outside the hospital. So as others, not only here in Enugu, across the whole Nigeria. So if government can improve on their salaries, provide accommodation for him, houses, even if he's on a mortgage basis, let it not be free. Mortgage, fine. Let the house be, they live in their house and they pay mortgage while they work. They'll be happy. Then make the environment a workable environment. It doesn't take much for you to have a befitting building, for you to have instruments, for you to have, the things that are needed. In some hospital, you prescribe drug for a patient. The good pharmacy says it's out of stock. You know what you think about that? Is it a rocket science for you to stock drugs in the hospital? To stock things?
Of course.
Go to do this and say, okay, the reagent is no longer there. You want to do this kind of invention, they say the reagent finishes and they are still waiting for it to be restored. You see, all these small things, and they should remove bureaucracy. Bureaucracy shouldn't be everywhere. If you see the chief medical directors of the hospitals, they are telling them that people are leaving, please employ. They say that they haven't given them a waiver to employ. What does that mean? You can't even employ to replace people who are not to take new, just to replace people who are leaving. You don't have the free will to do so. You are still waiting for approval, all this bureaucracy. And you are doing this, there are patients to be attended to on 24 hours basis. So what happens to those patients? It is those that are still remaining, that have been struggling. They'll still be taking care of those patients, of those advanced environments. You see, if there will be a way, the president of Nigeria will say, from today, I will be accessing health care in Nigeria. Everything will change overnight. I'm telling you. I'm telling you the reality. If the president wakes up today and say, from today onwards, I will be taking my routine medical checkups in National Hospital, Abuja, or the clinic in Asoro. I'm telling you, everything about health sector will change more than 50% automatically.
Well, you can't. I mean, it's a fantastic idea, but I mean, the president. I'm not sure he does his checkup even within this country.
He doesn't. He goes usually to France, as the news says, for his medical checkup. But you see, that France that you are going there, why wouldn't their president come to Nigeria for medical checkups? You see,
never.
We are going to take pride in what we have. It is only when we start taking pride in what we have. A governor of a state, for instance, we say, I will be coming to the hospital in my state if I'm having headache. And when that governor does that, he comes into the hospital, he says, wow, is that how the world looks like? Look at the floor, look at the walls, look at the rivers. What is happening? He will begin to ask questions. Then the chief medical director will now table down all the challenges they have. The governor will say, okay, let's start from here. When I come again for my routine checkup, let's see how the place will look again. Maybe after 6 months or 1 year. You can see that his presence alone will really change a lot of things. And his entourage, his friends, political appointees, and other politicians who are in the house, in the federal house, both federal house and state, senators, they will also be coming. Because this person have shown them the way they will also come on their own and say, okay, I'm going to provide this for this institution. Okay, people don't have enough, wards for patients. Because, you see, for some places like Akimbe, patients come, they say there's no bed. Because there's not enough. Have you had anything like that? Somebody that is sick, come to a hospital and there's no bed space for the patient. That means they can't take in the person. The person has to leave to go for another place. But if all the politicians are aware of this, somebody will come and donate a building. Say, okay, since the world is small, let me build you maybe 2-story building, 3-story building. He will donate it free will. And they have the money to do that. If one person, 2 person, 3 person does that, it will be a challenge. You see more people that will be coming to do something. Okay, this person did, okay, I'm going to do my own. Okay? There are other philanthropists. Can we equally come in? But the government has to show that they are committed. Before these people will start coming. The philanthropists, they have money to fly away to any country in the world to go and have their treatment. It doesn't concern them. They have the money. They can treat their families elsewhere. Okay? So for them to come here to begin to invest their money for the public good, then the government, who is the primary responsibility to take care of their citizens, people who have voted into power, it is the primary responsibility of the government to provide health, security, and all the basic amenities for their citizens. Okay? Not the private individuals. But where the government will begin to show that commitment to do this, government may not be able to do everything. Okay? But if they start, you can see, believe you me, our people are good and they have good conscience. You know, many a times philanthropists come to hospital to pay patients' bills.
Wow.
I'm telling you, tune of millions. Patients who have, had different surgeries, different treatments, stayed in the hospital like 1 month, 2 months, 3 months, 4 months, they are in the hospital, they can't pay. One businessman will come and say, he wants to help people. And he said, how many people have been discharged that couldn't pay? They said, okay, there are 10. Okay, what's their bill? He says, it's 10 million. He writes the check and walks away.
Walks away?
Yes, it has happened several times, which I have witnessed. So you can see that our people have the good heart to help. So what remains is the government commitment. Okay? Then there are people who want to invest in private health management, build their own hospitals, especially some of our people who are abroad. But do you know what happens to them? When you come back to help, the government officials will tax you to help. Starting from importations. If you look at the history of India, India is what they are today. Today everybody is going to India. Every little thing, I want to go to India. I want to go to India. Was India like that before? It wasn't.
It wasn't actually.
How did they come to be what they are today? It's because the government sat down and looking what are we going to do to make our health one of the best in the world? And they said, if you are a medical personnel and you want to import any equipment to help, the government will pay 10% of the price of that equipment you want to import, and there will be waivers of any importation.
Okay.
That's what India did. So people who have the financial muscle to buy different modern equipment started buying. So if you buy equipment of 10 million, government will give you 10% of that. That, your own government. The government will not tax you for importation bill. The government will not tax you where you have set up your hospitals. That the government helps you to pay off what you have imported.
So that was what India did.
That is what happened in India. Most of the hospitals you see people go to India to do are not government hospitals.
Wow.
They are privately owned hospitals, and you'll be marveled that you see it at 6-story high-rise building. That is completely a hospital. 36-story building, 40-story building.
Right.
A hospital complex. They does everything in that building. Everything.
Dr. Solomon, we just have to leave it there because of time. It's been an interesting conversation as it relates to the impact on the health sector, as Japa hates the health sector really badly. And from time to time, we will check in to see how improved the health sector has become. I'm hoping that the government of the day would also do something in that regard. Thank you again, Dr. Solomon, for your time. Truly appreciate it.
You're welcome.
All right.
Thank you. Have a nice day.
We're back after this. Just stay with us.
Save Nature TV. News in your pocket.